So, hello everyone. I am so happy to give this talk on behalf of ELPA. And I will present today some interesting facts and things that we can do with regard to prevention of NAFLD, especially in children, but also in adults. So, what can we do to treat and prevent NAFLD? We actually know what we need to do. And this is a figure that was recently published in the EASL patient guidelines, NAFLD patient guidelines, which I highly recommend to read. And this figure actually summarizes everything. So we need to have a healthy diet, Mediterranean style diet. These are on the left, the recommended foods: fish, fruit, vegetables, nuts, olive oil, rich in healthy fatty acids, fiber, vitamins, and minerals, and low in sugar, and low also in red meat. On the other hand, there is the unrecommended foods, which we need to eat as less as possible, like red meat, especially processed meat, like sausages, sugar, which is the enemy number one of fatty liver, alcohol, of course, and generally unhealthy ultra-processed food diet. And of course, there is always importance for physical activity. We should all have physical activity about 3 times per week, about 150 minutes per week of moderate aerobic exercise and also resistance exercise to increase muscle mass. So we know perfectly what we need to do, but we also know how difficult it is to implement these recommendations in practice. If we all keep this perfect diet, this Mediterranean style diet, it would have a tremendous impact on life, on globally, on Earth. So this beautiful Lancet study had several prediction models testing what would happen if everyone globally would adopt a healthy diet, as I just mentioned, Mediterranean style diet. So that would actually save 20% of the global deaths per year, which translates to 11 million lives saved per year if we all would be able to keep a healthy diet. But in practice, we can see in this figure on the left that actually we overeat the things that we should not eat. And in this study, we can see that in most countries and regions, the intake of unhealthy foods exceeds the recommended amount. The recommended amount is the green line. And you can see that most countries and areas exceeds in the consumption of red meat, processed meat, and sugary beverages. And this is not surprising because we live in such an obesogenic environment with so many temptations, and it's very difficult to keep a healthy diet. Looking specifically at children, we can see that obesity and unhealthy lifestyle do not distribute evenly. And we can see that children from lower socioeconomic parts of the society have greater obesity and worse dietary habits. So this is the health behavior survey among children conducted in the years 2017-2018. And we can see that the low affluence boys and girls, the blue and the red bars, you can see that they have greater overweight as compared to the high affluence children. They eat more sweets, they drink more soft drinks, and they eat less fruits and vegetables on a daily basis. And indeed, we can see that in a study from the United States among adults this time, NAFLD is related with food insecurity. So people with low food security or with greater food insecurity have higher prevalence of NAFLD and higher prevalence of advanced fibrosis. And let me just remind you, what is food insecurity? It's not only the inability to buy enough food, it's in fact the inability to buy healthy food, a variety of foods which are also healthy. So it's not only the inability to buy food, it's the inability to buy the right foods. And that is in fact the food insecurity issue. And so families with food insecurity would be able to afford mostly ultra-processed food and food that is rich in energy, saturated fats, and sugar, and have declined dietary quality, meaning they contain less healthy fat, protein, fiber, and vitamins. And that brings us specifically to ultra processed food. It is amazing to realize that, in fact, 50 to 60% of the calories per day in both children and adults in Europe comes from ultra processed food. Ultra processed food are, in fact, a major source in our diet of sugar and unhealthy fats, like saturated fat. So we want to eat as much as possible minimally processed food and to eat as less as possible ultra processed foods. This is the prevalence, this is the consumption of ultra processed food across several countries. So you can see that the consumption among children is extremely high of ultra processed food as percent of the daily caloric intake. And this amazing study of 2 weeks randomized clinical trial, people were given with either a minimally processed diet, like a healthy diet, and ultra processed diet. And the amazing thing is that during these 2 weeks, those with the processed diet ate more calories and gained weight. Why did it happen? Well, because ultra processed food is designed to be hyper palatable and designed to induce greater eating and greater caloric intake because it is so tempting. So it's not surprising that during the past decades, there is increasing prevalence of obesity among both children and adults. These are data from GBD from 195 countries, showing, as you can see, that in most countries, obesity prevalence indeed increasing. And we know that obesity in childhood is related to increased NAFLD risk in adulthood. Moreover, if we look in children, the effect of sugary beverages, of soft drinks among children. So this is a study showing something amazing. In 2000 infants, they show that infants that consume at least 2 sugar-sweetened beverages per day, including fruit juice, have 3-fold increased risk of developing NAFLD at the age of 10-year-old. Moreover, another study showed that soft drink consumption is not only related with NAFLD among children, but also with worse outcome because soft drink was related with a greater risk of developing NASH, the more advanced form of NAFLD, the inflammatory form of NAFLD. So it's not surprising that the American Academy of Pediatrics strongly states that we need to reduce sugar consumption and soft drink consumption among children. And they state also that excess consumption of added sugars, especially from sugary drinks, poses health threat to children and adolescents, disproportionately affecting children of minority and low-income communities. So we need to have public policies to protect these children. And indeed, there is sugar everywhere, not only in sugary and sweet foods, but also in salty foods. And it seems almost impossible to reduce sugar intake, especially among children, if we don't have food reformulation, meaning that the food industry would agree to reduce the amount of sugar in all these foods. And when we look at the dietary recommendations for NAFLD Mediterranean lifestyle diet, we can see that in practice, the NAFLD lifestyle is the complete opposite. So it's the opposite pyramid effect. So what can we do about it? On the top of it, there's a lot of advertising that is directed specifically to children. Children spend a lot of time on the digital media, and there's a lot of commercials and advertising targeting, especially the special sites and social networks that children go to. So they target these places specifically to publish and advertise unhealthy foods and drinks. And liver is affected by diet, by unhealthy diet and drinking, but also, of course, from alcohol and also from smoking. Many people are not aware to the fact that smoking actually increases the risk of NAFLD and advanced fibrosis. So it is clear now, and the ESA recommends that healthcare providers and patients needed to be educated on the frequent coexistence of these unhealthy behaviors, which all together synergistically lead to excess liver damage. And we should all, patients and caregivers, should have better knowledge about how to treat and how to reduce these unhealthy behaviors. Amazingly, when we look at policies to help us reduce unhealthy behaviors in the population, we see that the policies are the same for alcohol, obesity, and smoking. They all involve fiscal policies and pricing, like taxation. They all involve in managing the environment, the exposure to unhealthy behavior, especially about marketing regulations and bans on tobacco, alcohol, and unhealthy foods advertising, and of course behavioral interventions and education. So the same activities, the same measures can help to defeat all these unhealthy behaviors together. And with that, I really hope I gave you some food to thought, and it was a pleasure to give this talk. Thank you.